In this episode of Canopy Let's Talk, Doctors Richard Sullivan and Fritha talk about the blanket term chemotherapy. They explain some of the different types of treatments and look at clearing up some of the common misconceptions around chemotherapy.
Chemotherapy is what an oncologist is most well known for because it's got a long history and a bit of a bad rap. And what's important is chemotherapy is vastly different now. So people are liking chemotherapy to feeling sick, at home unwell, hair loss, nausea and vomiting. And sadly, yes, some of our therapies still do that, but we're much better at managing those side effects. But some chemotherapies will not cause hair loss at all. Some chemotherapies will cause minimal or no nausea. So they have different patterns of toxicity, and we've got better with those ancillary medications of trying to reduce that so that people have a better quality of life.
Chemotherapy is this very big word for a huge variety of treatments. And it's a little bit like antibiotics and bacteria. So when you go to your GP with an infection, your GP is going to try and choose the very best antibiotics to get rid of that bacteria, and they're not all the same. They all have different side effects and reasons you would use them. And so the side effects that you might get with the chemotherapy that you're having could be completely different from the side effects your neighbour had for a different type of cancer having a different type of chemotherapy. I had a patient who had chemotherapy back in the 1980s, and he needed chemotherapy again, and he said, I am not having that terrible stuff ever again. And so we talked about all of the differences that have occurred, because it really has changed, and it's the supportive medicines that have changed. So there are much better anti-sicknesses now. There are much better treatments that you take alongside your chemotherapy to keep you from feeling unwell. He went ahead with treatment, and he's had a very successful treatment, and he could not believe the difference.
When I meet a patient, I'll describe to them that I'm a drug doctor, and I say that because in my world I'm called a medical oncologist, but in fact I now deliver 3 large groups of drugs. So I either deliver targeted therapies, which are often oral therapies directed to a specific mutation or area of damage in a cell, chemotherapy, which I guess is what we're known for, and I'll talk about more in a second, and then the third group's immunotherapy, which is where you're trying to improve the immune system's ability to fight the cancer. Chemotherapy is trying to damage the heart of the cell, the nucleus of the cell, to destroy those bonds and break the cell down. But even chemotherapy has changed over the last decade. So we used to be very generic. Nowadays, there are hundreds of different recipes within the chemotherapy world, and each recipe is specific to a specific type of cancer, and even subgroups within that. Every cancer will have a different pattern and pathway, and even at an individual level, a different pattern and pathway, what's right for that person. So some people will just need surgery. Some people will just need radiotherapy. Some people just need chemotherapy. Some cancers require all 3, and it could be in any order. And again, that's very specific to the type of cancer, what we call the stage, so how advanced it is, and the other markers that you'll pick up when you're trying to diagnose it. In my practice, looking at people with lung cancer, there's a particular treatment program that'll only use for somebody who has an adenocarcinoma, or use a different program for somebody who has what's called a squamous cell carcinoma. So I have different recipes to direct against those. And what's important is chemotherapy is vastly different now.
One of the things that people are really worried about with chemotherapy often, and they talk to me about, is they say, well, why should I reduce my body's immunity when I'm trying to fight this cancer? And actually now we're starting to think that perhaps our understanding of immunity has actually not been quite right. So there are some research studies suggesting that particular types of chemotherapy, while they lower your immunity to bacteria, they might actually increase your immunity in terms of cancer. And also now, some cancers, we're giving an immune boosting treatment alongside the chemotherapy. So these are the things that are going to change over the next few years, I think.